Welcome to The Inside Track, where we talk all things health, healthcare and medical insurance. Brought to you by TRA and our team of Warren, Alan and Doc Avron. Let's sit back and see what our team has for us today.
Welcome everyone. This is our 9th Inside Track podcast. Can you believe it? And today we are covering some fantastic topics. As usual, our response to the previous podcasts have been so good. We're over 3,500 views for our 2 medicinal cannabis podcasts.
It's incredible.
And the back surgery one is already over 600.
Oh.
So that's only in a couple of days. So
it's fantastic. Really good.
Yeah. And as I always say, guys, we're covering such relevant important topics.
Yeah, for sure.
And we've actually started to get quite a few questions coming in.
Yeah.
So we will put the email address at the end of the show, the podcast. But please send in topics you'd like covered or any questions you have on the topic of the day.
Yeah, and there's no irrelevant question for Doc. Please
absolutely
ask you to please forward your questions.
Sure.
Yeah, definitely.
So in today's episode, we covering the topic of aesthetic medicine. And you had a lovely interview. If you want to give us,
yeah, sure. No, this is becoming an incredibly growing field internationally and in South Africa. We had received quite a few questions on this. We thought it's a very important topic to cover: aesthetic and anti-aging medicine. And we found a top specialist actually in South Africa, Dr. Talia Natelevitz. She's a specialist in aesthetic medicine, and this is what she had to say.
Great. Let's have a look.
Dr. Talia Natelevitz, welcome. So nice to have you with us today.
Thank you, everyone. Thanks for inviting me. Great to be here.
Sure, and really looking forward to discussing this topic as we unpack it today. But Talia, I think let's kick off for our listeners and our viewers out there, just to really explain to them, or for you to explain to them, what the difference is between aesthetic medicine and plastic surgery, and really asking, what is aesthetic medicine and how does it differ from plastic surgery?
Great. That's a great question, everyone, because I think there is a bit of confusion around that. So both fields of aesthetic medicine and plastic surgery, we help our clients to improve their aesthetic appearance. And the aim of that is to improve quality of life. So unlike other fields of medicine where doctors are dealing with illnesses, we are looking at well people, but looking at how to improve their quality of life and their self-esteem by improving parts of their appearance that might be bothering them. The difference lies in the techniques that are used. So with a plastic surgeon, they are using surgical techniques, which translates really as cutting of skin and suturing. So those procedures will be done either in theatre under a general anaesthetic, or they can be done in the plastic surgeon's rooms, but under sedation. So they are a lot more invasive and also have more downtime, so recovery time after the procedure. Aesthetic medicine uses medical techniques, which means things that are less invasive, for example, injections, or other skin treatments that can be done for the skin, but are done in the aesthetic doctor's rooms, not under sedation. Sometimes we use a bit of topical anesthetic, and there's generally very little recovery time needed. So those are the basic differences.
Right. So I think the two main areas, if my understanding is correct, that well, the two big areas, let's say, aesthetic medicine specialists work in is one, the botulinum toxin, which I'm probably having viewers and listeners saying, well, what is botulinum toxin? So I'm going to say that in one of the trade products of that is Botox, but we'll call it botulinum toxin for the purposes of this program, and fillers. Are sort of big areas that we've had a lot of questions about. What is involved, how's it done, etc. But let's kick off with botulinum toxin. Sort of what are the indications? When would someone consider having botulinum toxin from an aesthetic perspective? And how does that differ from when you would sort of a medical functional perspective?
Right. So botulinum toxin is a good place to start because that is the most common aesthetic procedure today. And becoming more popular. So botulinum toxin, if I can maybe just explain a little bit about how it works, because that will lead us into the uses. So it works by relaxing muscles. It is a substance that is injected into muscles in tiny amounts and stops them from contracting. So in aesthetic medicine, we use them in the muscles of the face to stop those from contracting. We have tiny muscles all over our face that give us facial expression. And some of those expressions, if repeated, will leave lines. So for example, the frown lines between the eyebrows, which are sometimes called the number 11 lines because they look like an 11, are caused by repeated frowning or squinting. And with time, the collagen in that layer of skin breaks down, or in that area of skin breaks down, leading to lines. So what botulinum toxin then would be done in those cases would be to relax the muscles and so improve on those lines. And eventually we hope to with time, that they could fade completely. So in terms of your question, Evron, is that people with expression lines that they want to soften or fade and possibly remove depending on the case. And those lines are mainly the frown line, the crow's feet around the eyes, the lines, the horizontal lines across the forehead. And then there are other areas of the face, on the lower face, that can also be treated to help give a little bit of a lift to those areas.
But is it age dependent? In other words, would I only consider that, would an individual only consider that from a certain age? Can you have it done at any age? When would one look to having that done?
So it doesn't necessarily depend on age. With age, more people would start noticing those lines. So let's say by the 40s, most people would start noticing lines in those areas, but many people earlier than that. So for example, in the 30s, already people can start developing lines, and even in the late 20s. So it would increase as one got older, but it is very individualized, depending on how one uses one's face and expression and on the skin type. One does also have a group of patients who are in their 20s and are wanting to use Botox preemptively, using smaller doses to actually prevent those lines developing in the first place, which, although I wouldn't say something is absolutely necessary, this is an option that is available to people.
Okay, so someone comes in to you, they say they've got these lines or they're developing these lines. They want to talk us through how the procedure actually works, and sort of when you do it, and then when would they have to come back for repeat procedures, etc.
So if someone is very sensitive to pain, I do use some topical anesthetic, but in general, people don't really need that. We would clean the skin, we'd put some little marks to mark out where the muscles are, and then they would have a few injections, let's say 5 for the frown, a few, 3 and 3 for the eye, so a few small injections, which are really not very painful. There isn't really any downtime. There would just be a few things that they should watch out for afterwards. For example, not rubbing their face. They shouldn't lie down for 4 to 6 hours. They shouldn't exercise on the day of the treatment. And for 2 weeks, they shouldn't have any facial massage, such as having a facial or something similar to that. The effect they would start to see from about a week to 2 weeks would be the full effect. And what they would find would be that they are unable or very little able to frown or to lift up the eyebrows or give whatever expression it would be. That would be how we could see that the Botox had been successful. And with time, then those lines would start to fade.
Okay, Talia, so that process actually sounds interesting in terms of the way it works. Tell us a bit about, are there any complications or side effects of this botulinum toxin?
So in the vast majority of cases, absolutely not. There are rare cases where one can have something that is localized to an area and is temporary. So that often depends on the injection or the technique of the injector. Choosing someone who is more experienced will minimize the chances of that. So I think everyone's heard about getting a skew smile from Botox, a drooping eyelid from Botox. So of course, these things occasionally can happen. But, you know, we're talking sort of a 0.5%, 0.01%, but depending in whose hands that injection is. So that's a very important factor.
Right. So it's really, from the individual perspective, they must actually look at the practitioner they're going to and obviously check that they've done, obviously, that they've got the right amount of qualifications and done the right number of procedures to actually have the experience. And then what you're saying is that the risks are relatively low in terms of those types of side effects.
Yeah, definitely. Yeah, the risks are really low.
So now we've had someone who's come to you, they've had their first course of botulinum toxin. It's been the injection therapy. They've done what they need to do for the first week or two. When would they have to, how long does it last for? When would they have to come to you again?
So I often do a 2-week checkup the first time that we are doing a treatment, just to make sure that everything is settled in properly. You know, muscles can act a little bit differently between individuals, and occasionally a little bit of a touch-up to get things 100%. And then the toxin itself will last between 3 and 4 months. And what the person would find is that the movement would start coming back. So it does vary slightly between people, but I'd say between 3 and 4 months, that would be the time to revisit your aesthetic practitioner.
Do most people do it as a once-off, or is it ongoing therapy, i.e. every 3 or 4 months, then they'll obviously have those injections?
Look, there is the occasional person who wants to do something just before a function, a wedding. But in most cases, I think people really enjoy the result and therefore they want to continue with the process.
Sure. The question we've been asked is Botox or botulinum toxin addictive in any way?
So that is quite a common myth. And I think it comes from the fact that people who start having it continue. But the reason they continue is not because of any sort of addiction. It's just simply that they enjoy the result and therefore they want to continue having that result. In fact, the opposite is true, because in an addiction, the individual needs more and more of the substance to get the same effect. Whereas with botulinum toxin, over time, the amount and possibly as well the frequency for the injections is reduced. And there certainly are no withdrawal symptoms from botulinum toxin. So absolutely not addictive.
Right. So here's the question, and you've just brought this up now. Let's say someone has these injections over a 3 or 4 year period. Is there a chance that sort of those lines would be decreased over the time? Not totally, it wouldn't disappear, but be decreased to an extent that they would be happy to stop treatment?
So there certainly would be an improvement at that point. And if the person then stopped, that improvement would stay there for a while. But if they didn't continue with the treatment, the muscle movement would then return, and so would the lines. So it's a matter of treating and then maintaining.
Right. And just before we move off botulinum toxin, tell us what other areas in medicine is it used?
Right. So interestingly, we think, or the public tends to think of botulinum toxin in terms of the aesthetic indication. But in fact, it was initially used in the 1970s by an ophthalmologist. That was the first indication for botulinum toxin and was used to treat squinting. And then other indications in that area developed, like spasms around the eyes, and a whole lot of neurological problems. Again, spasticity. That was actually the initial use of botulinum toxin. So only in 2002 was it approved for aesthetic use.
Right.
And today, apart from the indications in ophthalmology, neurology, we also use botulinum toxin to treat hyperhidrosis, which is a condition of excessive sweating.
Mhm.
And we use the botulinum toxin there to reduce the activity of the sweat glands. We also use it for bruxism, or clenching, grinding of the teeth, which causes temporomandibular joint dysfunction and pain. And there are other areas, such as in neurology, where botulinum toxin has been used. So there actually are quite an array of other medical treatments.
It sounds like a versatile and well experienced drug, if I can say it like that. And and for our listeners, it's been used for many years, right? And hence, obviously, the safety profiles that you explained.
Yes, absolutely. It's been also used in children with cerebral palsy at doses that are much larger than we would use for aesthetics. So we have a lot of safety data.
Yes. Yeah. Okay, great.
Okay.
I'd like to move on to anti-aging creams, right? We've had a lot of question about all the different types of anti-aging creams, and I suppose the question coming out there is that, do they work, or are they just a waste of money for our listeners and our viewers?
So I think everyone, actually both are true. Some work and some are a waste of resources. And it depends which products we are talking about. So we need to distinguish between cosmetics and cosmeceuticals, and then again, prescription products. So cosmetics are the type of thing that one would get in a sort of a general, say, beauty store, sometimes in clothing stores. And the aim of those actually is not to treat any skin condition or aging. The aim is to make the skin feel nice, look temporarily nice. Occasionally there are claims made about anti-aging benefit. There may be a little bit, but really they are, I would say, if we think of them as chocolates, they're delicious, they taste nice, they feel good, but they're not medicine
Yes.
for the skin. So that, in terms of, I think, if people know why they're spending the money and that's what they want, then, that's fine. But that's not going to really make a difference, a significant difference to the condition of the skin. So the next group are things which one can find in, for example, a pharmacy, but don't necessarily need to be prescribed or advised on an individual basis. And here we start having things that actually are effective. So research has shown that certain vitamins, such as vitamin A, vitamin C, other compounds like alpha hydroxy acids, are actually beneficial in terms of reversing and preventing the aging process. So I think our public has become a lot more informed with reading up on things, which has got a positive side in that they are more able to go and see what sort of products they want. The disadvantage is people often are a little bit overzealous with things, will sort of read everything that they can and then just decide they're going to just use everything which might not be suitable for their skin type.
Sure.
But there are certainly products available that have an effect. If one then wants to go up a little bit of a step, which is now, we say, in the cosmeceutical range, meaning it is, let's say, more of a pharmaceutical type of grade, that sort of thing one would want to get from an aesthetic clinic, preferably advised by either a doctor or someone who was a qualified skin therapist, who would be able to analyze the skin and determine then the best treatment for that skin. So the concentration of those active ingredients would be a little bit higher, and therefore would need to be given and explained to the patient exactly how they should be used.
Right.
So now we go on to the products that are available only on a prescription by a doctor, available from the pharmacy, and specifically the vitamin A derivative tretinoin, which is a highly effective treatment for anti-aging. Initially, it was used for, and is still used for, the management of acne. This would need to be prescribed by a doctor. It is very potent. It also has significant side effects. So it would be important for a doctor then to explain to the patient how to use it, when to use it, and also to ascertain whether it would be suitable for that patient. So as you can hear, there's a whole range of different skin care products.
Sure.
And some of them are highly effective in terms of the anti-aging process, and some not.
Sounds to me the more effective ones that you want to get would be the ones that when you get prescribed by or suggested by a medical professional or an aesthetic specialist who actually knows what they're suggesting and what you should be taking. But I suppose that's the advice to individuals. Do your research, and there certainly are anti-aging creams that do work. But there are also some that waste money, so you actually need to do your research around that. But it sounds like sort of the vitamin A group and vitamin C group are quite effective if given correctly.
Right. So we call those active ingredients.
Yes.
And the vitamins, yes, the vitamin A, vitamin C, vitamin E are very effective. Other compounds, I mentioned the acids, alpha hydroxy acids. And one thing that I nearly forgot, which is the most important of all, is sunscreen,
Yes.
which really is critical in terms of anti-aging, because the main cause of extrinsic aging is the sun.
Yeah.
And especially in a country like South Africa, where we have a lot of sun exposure, the best thing you can do for your skin would be to wear a good sunscreen every day, winter and summer.
That would probably be your most effective anti-aging cream, right?
Absolutely.
If you're going to spend
absolutely.
on something.
If you were going to do one thing
Yes.
only, I'd say invest in a good sunscreen. And then there are a lot of other compounds that are used, things like growth factors, but your basics would be an antioxidant like vitamin C, something for anti-aging, vitamin A, an alpha hydroxy acid, and number one, sunscreen.
Right. Talia, if there's one message you'd like to leave our listeners and viewers, what would that message be in the field of aesthetic medicine?
Right. I'd say, as we said, everyone, remember this is medicine, and therefore make sure that you are going to someone qualified. Certainly needs to be a doctor. And then, in terms of experience, training, someone reputable. That would be my take-home message.
Thank you so much. It's been absolutely an education, fascinating. Dr. Talia Ntelevitz, a specialist in aesthetic medicine. We look forward to bringing you back onto our show in the future to hear the further developments. And thanks so much for spending the time and educating us today. Thank you.
Right. Thank you. Thank you so much, everyone.
Thanks, everyone, and goodbye.
It's a very, very important topic and a very, very field that's quite in demand these days. I think the Americans have set the trend in this regard. There's no doubt it has taken South African by storm as well.
Yeah, and I think what came out of the episode, Alan and Warren, is that it's not just the famous people out there who are actually going for aesthetic medicine procedures. A large portion of the population are, and not just the aging, right across the board. And I think Dr. Ntelevitz, Talia, actually explained it really well. And there was a lot of interesting information. It's a growing, expanding field, and we should watch it closely.
Sure. Yeah. Doc, I just want to maybe add, it's just not only about looking good.
Exactly.
There is definitely a need for it, and there's a place in general medicine for it, because it serves a very, very important purpose. It gives people self-belief where it's required, and so there's this big psychological part to it as well.
Yeah.
But I think if I can just bring the TRA's look at it, we saw there were some valid medical uses as well, not just cosmetics.
Yeah.
There's actual medical conditions that require, and we saw a list of those. So the logical question would be, how does TRA cover that from a gap cover policy point of view? And the same rules apply. I mean, if your medical aid is going to approve the procedure to come out of your hospital benefit, and there's a shortfall on that specialist account, and they use, for example, the Botox, then on the TRA gap cover policy, we clearly say that we cover consumables, shortfalls on consumables across all of the plans.
Sure.
So in that way, TRA does assist there as well.
Exactly, a very important point. As Dr. Televet said, I mean, often the botulinum toxin was actually initially used for direct medical purposes and not cosmetic.
Sure.
Before it was approved in the early 2000s for cosmetic.
And I think that's what TRA as a provider will support.
Right.
Obviously not the cosmetic side, but certainly that medical side.
Yeah.
And I think it's a lovely topic that we've looked at. But something maybe a bit different. We've just had the release of the Council for Medical Schemes 2024-2025 report on the state of the healthcare industry.
Right.
Very topical right now. People have seen increases coming for next year. They've seen benefit changes. Now we hear from the regulator in this regard. I think Alan's going to run us through it. But Al, let me ask you, some of these key learnings that we had. Number one, the shift to value-based healthcare.
Yeah, Warren, value-based healthcare is a very, very important topic, particularly in, let's take the South African healthcare market. Healthcare runs above headline inflation, so it is very, private health in our country is expensive.
Sure.
Joe Citizen has become poorer over the last couple of years, maybe 20 years. So private health to fund it is expensive, and quality healthcare outcomes is what the industry is driving at. So my view is that a multidisciplinary approach to a procedure or a health condition will give you better outcomes. There's no doubt about it, because you've got all the specialists around the patient and everybody's treating the patient as best they can. It's shorter, it's quicker, and the procedure is done, should be done quite cheaper, but the quality is there.
Sure. And that's the value base that they talk
Sure.
about. Yeah.
Sure.
Let's look at the next one, rising utilization and financial pressure. This is not news to us.
Yes.
Yeah, I mean, I've just for interest sake talk about how expensive private healthcare is, and it's not only a phenomenon to South Africa.
No.
Across the globe, it's expensive. When India looked at their private healthcare sector, that was just taking off, and I was still working in Africa at that stage. Private health in India was maybe a third of the price that we had, but it's caught up because it's just the new technology that drives the inflation of healthcare.
It's an expensive business.
It is an expensive. Private health is an expensive business because you pay for the best.
Yeah.
The protocols that you see that are in private health in South Africa today will drive inflation up because the patient is demanding the best treatment.
Sure.
And we have world class private healthcare.
There's no doubt about that.
And you can understand from a CMS point of view why they are always focusing on the value and then cost.
Yeah,
Sure.
The two of them need to work in
there
conjunction.
is a missing component here, and the missing component is the reference price list.
Sure.
You got to have a regulatory kind of environment, because there is instances, and it's dichotomy, where a provider will charge a scheme rate and the next provider down the road will charge 700% of scheme rate. So there's got to be a balancing act here.
Sure.
And the only balancing act you can get is the reference price list.
Sure. But I guess that's why it makes sense to have your TRA gap cover policy.
Correct.
So at the moment,
There's no reference price list.
It's exactly the reason why you need it.
Sure.
Yeah.
That's the third point. Let's focus on fraud, waste, and abuse. That's interesting.
Yeah, fraud, waste, and abuse is a big problem in our healthcare system. Particular certain regions, it stands out more than other regions. There is a problem, and we have to address the problem.
Sure.
Because it's the very problem that pushes healthcare up. It's like corruption in our country. Corruption makes everything more expensive because money or resources are not applied where it should be applied. So the council's initiatives, VHF initiatives, the industry's initiatives to curb fraud, waste, and abuse in the system is fundamental to producing good quality health.
Affordable health.
And affordable health.
Yeah.
100% off.
Yeah.
And I guess that sort of ties in with their fourth point, the integration with the National Health Insurance, NHI, because effectively you would expect the Council for Medical Schemes to sort of back what's happening from a from a regulatory point of view. But how does that sort of tie in?
Yeah, Warren, the quicker we determine what the basic minimum package is for universal health, that means maybe stay away from national health, because I'm a big and a firm believer in universal health cover. Once we've determined what that basic package is of the universal health, the quicker we can get actually to calculate the price, because we're talking about the population here.
Yes, no, sure.
And once the population knows what the minimum package is, you can design the workings of the regulatory framework around it.
Sure.
How do we procure? How do we monitor? How do we ensure quality?
Yes.
But we can't, in a country like ours, do it out private health. And private health will have to fund above the minimum package. Okay, that's another mechanism that my belief is that it will make healthcare a little bit cheaper in our country. But one must say we are very, very long way off that.
Sure.
Yeah.
What I do find encouraging is this last point that we've taken out of the report is the digital transformation and data-driven regulations going forward.
Yeah, look, there's a couple of areas I know the council has been looking for a while. One is digitizing, but integrating all medical schemes. We come from a background where we thought that we'll see social health principles being implemented, ensuring every patient record is integrated, doesn't matter which service provider you
And you're correct. And the important thing is it's real-time data capture.
Yeah.
So that's what they're looking for.
Yeah, we want a system where if Dr. A treats a patient and the patient consults Dr. B tomorrow,
They know.
and
Yeah.
Dr. B would just pull up the record and
You want one medical record. Now we know even in the private healthcare system, if you go to different providers, you've got to fill out that form. Yeah, right.
Yeah.
I mean, we want all our records captured digitally, and for the individual to have access to it, and if he goes to any provider to actually be able to access it.
correct, 100%, Doc. And we have the systems that can do
Yeah.
that. It's important the role players
Yeah.
get together with the regulator. And of course, the patient always has got right to its own information, and the patient can grant the service provider the necessary approval to access the records, because it does contribute to lowering of costs. Because if you go to practitioner A, practitioner wants to do investigations, pathology, and so on, and practitioner B, when you're consulting next, does the same kind of investigations, it's costly.
Yeah.
Exactly. Just replicates
I think what's important here is that they're expecting it from schemes and providers. So it's that global expectation.
Yes.
It's that the global
100%, Warren. 100%.
expectation. So I think that's positive news.
Yeah.
And I think it's a good note to end this episode on.
Maybe, Warren, before you conclude, the digitization and fraud, waste, and abuse is really integrated.
Sure.
Yeah.
You
Sure.
can't make decisions on something you don't have, and you need the data.
No, I think it will definitely work together. You have the digital that will actually help mitigate the fraud risk.
Correct.
Working together with the AI. So we're moving in the right direction.
Yeah. Well, that's another great episode.
Brilliant episode.
Do you think we've seen so much good information again and positive learnings for going forward. So
Yeah.
very happy and looking forward to the next podcast. And I think all we've left to say is
Yeah. Have a great one.
Have a great
Cheers,
one.
everyone.
Thanks, everyone, and thanks for viewing. We'll be back with another episode. Thank you very much.
Cheers.
cheers.
Don't stress, the gap is covered.
Well, there we go. Thank you to the TRA team and to you for watching the Inside Track. Until next time, bye for now.